Hey guys, this is a lower body foam rolling routine. So if you haven't already watched in the client portal the video about warming up and foam rolling, go ahead and watch that now. We talk a lot about foam roller selection in there. I like for my lower body to use a foam roller that's a little more on the spiky side and a little bit more intense because we have a lot more meat in our lower bodies to work through. So something like this, that's obviously a less intense foam roller, is going to have less of an impact on our muscles, right? And again, if you haven't watched that module, go ahead and check that out. The flooring you're foam rolling on is going to make a big difference as well. So please be mindful if you're foam rolling on carpet versus hardwood, you're gonna have a very different foam rolling experience, okay? So I like to start off for my lower body with my glutes. And again, I like to use an intense foam roller, but it is up to you how intense you wanna go. So start off just by sitting on the foam roller. That's step number one, just sit right on it, okay? From here, if I wanna foam roll my left glute, so that's the leg that's closest to you guys right now, I'm gonna cross that leg over and I'm gonna tip towards the knee side. So if I were to foam roll my right glute, I would cross my right leg over and tip towards my right. I'm doing my left, so I'm gonna cross my left leg over, tip towards my left, okay? And from here, I'm just gonna shift my weight all the way up to kind of the top of my glute and then back. Shift to the top and back, okay? Where you feel somewhere that's a little tight, just pause, feel the tightness, give it about 30 seconds hanging out on that sore spot, and then keep going, okay? Once you've done about 5 to 10 passes on that side and pausing where you feel tight, you can switch, okay? Now, for the quads and the thighs in my lower body, again, you're welcome to use an intense foam roller or you can tone it down a notch with a foam roller like this. Totally up to you. I like to start at the top of the hip. So I'll foam roll, again, my left leg here so that way you guys can see because that's closest to the camera. I'm gonna start way up at my hip, okay? Almost at that groin region. My opposite leg, see, get an angle so you guys can see. My opposite leg is just kind of kicked out to the side in kind of a frog type position, right? So just kind of keep that opposite leg, kick it out there, right? And again, starting up at the hip, I'm now gonna roll all the way down to my knee. And all the way up back to the hip, right? Again, same thing, wherever you feel any tightness, just pause, give it a couple seconds there, about 30-second pause where you feel that tightness or that pain, and then keep rolling, okay? Now, to get that inner thigh, I like to turn. So now you can see the foam roller, my leg is kind of, this leg is kind of now more in a frog position. And I can do those same passes here, just shifting my weight back and forth. Let me get a better angle for you guys so you can see my whole body. And there we go, okay? And then once you get those passes done on that side, you can shift your weight again to get more of that kind of closer to the IT band. So if I roll, now I'm rolling my left leg. If I kind of roll to the side towards my right, I'm on my left leg, I'm rolling towards my right, I can get that kind of side of the quad in that IT band area. Now, when you're foam rolling near your IT band, same thing, do 5 to 10 passes, pausing where you feel tight. But one thing I wanna point out to you guys is make sure that when you're foam rolling along that IT band, you're not actually on the IT band itself. A lot of times the muscular tightness and issues associated with the IT band are due to the connection between the lateral quad and the IT band itself. So rolling the IT band is kind of a waste of time. You want to foam roll the muscle, not the IT band. That IT band is a band of fascia. You're not going to get very far with that. Fascia is really strong. You want to be foam rolling that muscle. So make sure if you're on your side foam rolling that IT band, you're not actually on it. You're on that lateral quad muscle, okay? So those are the, I guess, 4 movements. Yeah. Glutes, quads, inner thigh, and then IT. So those are your 4 movements for the lower body foam rolling routine.